Good afternoon, everybody. Welcome to the Harrisonburg Rotary Club on this Monday. Happy Father's Day to everybody from yesterday. That's one of the most important things I think in the world is good active fathers. So happy Father's Day to you all, and also happy Juneteenth. And I just want to mention about today, because a lot of this wasn't celebrated. It's been celebrated for many years, but hasn't been as actively known. We may not know that Juneteenth commemorates June 19, 1865, the date in which enslaved people in Galveston, Texas received the news that they were free. They were first announced. And I was just thinking about that today. As Rotarians, that's all about the four-way test, things that are fair to all concerned. And so we celebrate that as well. And so we will do that as we always do and remind ourselves of the things we think, say, and do. First is the truth. Second is fair to all concerned. Third will build goodwill and better friendships. Fourth will be beneficial to all concerned. Today's song is by Noah and Surprises. I don't know what you're singing.
God bless America.
God bless America, land that I love. Stand beside her and guide her through the night with the light from above. From the mountains to the prairies, to the oceans white with foam. God bless America, my home, sweet home. God bless America, my home, sweet home.
Now let's turn to the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And today's invocation is by Paul Lehman.
That's great. God, we thank you for today, Juneteenth, a day to commemorate equality and equity for all people. Thank you that is a value of us as Rotarians, and we pray that as we go about our work and people that we meet, that we will uphold each individual with dignity that you hold us with. Thank you for this food that we've been able to share together and the ability to catch up, fellowship over food. We thank you for our program and Rebekah and her leadership of the Harrisonburg Community Services Board. And thank you for the services they provide to bring better justice to those who have needs beyond what we can do individually. Give you thanks for all these things. Christ's name, I pray.
Dan, would you introduce our guests and visitors, please?
Good afternoon. Good to see everybody. We have one guest today, David Wanger. He's been with us here before, and I think he's up for membership soon. Okay, that's who we have. Welcome, everybody.
Okay, I'm opening up as I always do. Anybody have any family of Rotary? Things you want to share with us? Okay, so a number of announcements. So the person that may be watching virtually, prepare yourself, because we are going to end the end of June. Our board decided at our last board meeting to end the virtual meeting for this reason. We have averaged 0 to 1 for the last 2 months. And the amount of volunteer setup time and teardown time it takes when we are safely meeting here. So I just want to prepare those folks that if you want to join the Rotary Club, join us here. And we decided that we weren't harming very many, that we weren't being unfair to many, because it's been 0 to 1. So that's where we're headed. With that said, I also want to mention to you the Rotary Social coming up on June 29 at Bella Luna, 5 to 7. Won't cost you anything. Hors d'oeuvres, drink tickets. We have invited the B Cube community to join us as guests. Right now, I was told by Braden, we have 10 guests signed up and a handful of us. So I would encourage you it's a good way to connect. It's a fellowship event and a membership event. Come on out to Bella Luna. But Michael in the Rotograph has sent out the signups or the response that you can do. But please, we'd love to see you out networking, welcoming others in our community on June 29th. Also, Ash Heatwell has graciously agreed to take over Les's many years of service in coordinating prayer and song. Many of you cannot sing as well as Noah can lead. They may not be able to lead as well as Noah or Lynn, but I know many of you can do it. I know Don has done a great job and others. So we're looking for those that would take a turn leading us in a song and those that would offer to do the invocation. So Ash is sending that around. Reach out to me, Michael, anybody else if you can't find it. Looking for signups for that. So with that said, I think that's all we have today in the way of announcements. And I will call up Rodney one last time to introduce our speaker.
One last time. That sounds all right, but I guess I don't get it out of everything, but I'm getting a jump start on my president's duties today. When I leave here, I'm on my way to Blacksburg, so I think some of you already know this, but tonight in Blacksburg is the night when Andy gets installed as the district governor nominee, I think. And so I'm representing our club this evening in Blacksburg, and we'll bring back the big governor nominee banner that we will hang for the next year. And so that's going to be my afternoon and evening. I thought I wasn't going to be here. I thought it was an afternoon, but now it's the evening, so I get back like at midnight. But we have Rebekah here today. Rebekah Brubaker is the new director for the Rockingham-Harrisonburg Community Services Board. She has over 17 years of experience working with children, families, and adults, providing mental health and substance use treatment services, and has held a variety of leadership roles within the Community Services Board. She's a graduate of Eastern Midnight University, where she received her Bachelor's of Science in Psychology and Master's in Counseling. She has been a licensed professional counselor in the Commonwealth of Virginia since 2008. Rebekah lives in Timberville with her husband and her 2 teenage sons. Welcome, Rebekah.
Yeah, that'd be.
Well, thank you for the, am I on? Okay. Thank you for the invitation to be here. I'm pleased to be able to speak with you all.
Yeah.
How about that? Is that better?
Yeah.
Yeah, a little bit.
Nice catch.
There we go. How about that?
I could bring it down a little bit, sort of bring it towards the center.
There we go. Okay. As I was saying, it's a pleasure to be here and to be able to share with you about Harrisonburg Rockingham Community Services Board. So let me get started. So I want to give you a little bit of a framework in terms of who we are and how we came about, and then I'll talk with you a little bit about our services. And so, in case you aren't familiar, Virginia has a publicly funded mental health systems, and that is our CSB system. So there's 40 of us across the state of Virginia, and we each serve a different catchment area. And so back in the 70s, when the state of Virginia decided to move away from institutionalizing individuals with serious mental illness, they declared the need for community-based services and then put into code the need for each community to have a community services board. So it's in code, and the code is written to have a partnership between the state and our localities. So we are what we call quasi-governmental. So we have some ties with the the General Assembly and with the Governor's Office and the Department of Behavioral Health. But we also have ties here to our local community and some responsibilities and obligations to our community, as well as to the Board of Supervisors and the City Council. So as I mentioned, the Department of Behavioral Health, that is the entity of which we are licensed through. We also have a contract with the department to provide services that the state funds. And so that's, again, a piece of where the relationship with the government comes in for us. STEP Virginia is 9 core services that all CSBs across the state of Virginia have to provide. So this was an initiative that came out in 2016 that required that all of us have some uniformity between all the CSBs. And what this did for Virginians is to provide the opportunity that if they move from Harrisonburg to Stanton, that they could get the same services that they were receiving at Harrisonburg in the Stanton CSB there. And so that was a desire to make sure that the quality of care was universal across the CSBs. Now, as I mentioned earlier, we have a relationship with our community, and so that also affords us the opportunity to have services that are unique to the needs of those in our community. Each community has different issues, have different dilemmas that they're facing, and so we are able to carve out and create some programming and services that are specific to our community. As I mentioned earlier, the CSBs were created in the 50s, so HRCSB started in 1972, so we just celebrated 51 years of being in service here in our community. And it's been wonderful in terms of the evolution of our services and the growth that we've had over those last 50+ years. So a little bit more about our CSB. Here's our mission statement, in case you aren't familiar with it. It's a little wordy, so I won't read it, but for what it is basically we want to make sure that our individuals that we serve are able to engage in life to the fullest extent possible, to which they determine that. So we are not in the control, we are not in the driver's seat of determining what is in an individual's best interest or where they should be. That is a joint adventure, journey between the clients and the staff. And so we are helping them determine what it is that they want for themselves. And so it is very much we walk alongside of you in that road. Our sources of funding, because people always want to know how are we funded when we say we're a publicly funded organization. So as I mentioned earlier, we do get state funded support, and that comes through General Assembly. So currently there are some budget amendments that are under consideration that would help support some additional public mental health, substance use, and developmental services that would directly impact us, which is always helpful. We also receive local funding from the Board of Supervisors and the City Council, so we get some funding from both of our local localities. We also bill insurances for providing services. We also do a sliding scale fee for folks, so if they're uninsured, we base their fees on their income. And then we also apply for grants, and so we do grant-funded programs as well to help fill in gaps. So this, I need to just share this beautiful new building that our local community helped us get. This is our new facility. We moved in July of 2021. So we're on North Main, if you aren't familiar with where we're located. We're on North Main there, and so this houses the majority of our programming. It was a much needed, if you are all familiar with our old building, this is a much needed addition to the community to provide services that are warm and welcoming to the individuals that seek support. And so you're always welcome to stop by, always happy to have people come look at the new location. Mathers Architect and Lance Construction were the ones that helped us build this building. So who do we serve? As I mentioned, we have a certain catchment area, and so we serve the residents of Harrisonburg and Rockingham County. We are also considered a safety net organization, so we work with many other nonprofits and government agencies to ensure that we are meeting the needs of those who are most vulnerable, who are underserved or underinsured, to make sure that they're accessing the mental health, substance use, and developmental services that they need. So I'm going to talk with you a little bit about different programmings. I'm not going to go through all of them, but I'll just highlight a few. I'm happy to, when I'm done, if you have questions about anyone specifically, I'm happy to expand on that. But a couple of the ones that I'll highlight in our adult services. So we are divided up our organization so that we do mental health services, substance use services, and developmental services. And so we do them across the lifespan for birth until death for individuals in each of those areas. And so for our adult mental health services, these are some of the programs that we offer. So that's 18 and above to individuals who have a mental health diagnosis. And so that can be anything from depression, anxiety, all the way to your more serious ones like schizophrenia. And so these services are available to individuals in our community to help support them to stay in our community. That is our goal, is to make sure that folks are here, living independently as possible, working if they're able to work, getting the support that they need. So the ways that we are able to do that are through our outpatient clinic services and some of our more intensive programs. So some that you may not be as familiar with would be our Summit House Psychosocial Rehabilitation Program. So that's out on Pear Street, which is on South 42, right off of, down by the food line there on South 42. It's off one street removed from that. And that is a day program for adults with serious mental illness. And so sometimes individuals who have had a lifetime of serious mental illness have a hard time engaging in community integration and being a part of groups just like this. And so they have a hard time socializing, knowing how to interact. And so we have this program, and the whole purpose of the program is to help individuals develop the skills they need to learn how to relate to individuals, as well as develop the skills to be independent in their living and possibly employment. So the program is designed to teach skills like maintenance skills, kitchen skills, working in the kitchen, learning how to use a dishwasher, learning how to cook. It also teaches administrative or clerical skills, answering phones, making copies, doing some of those other things that can be meaningful for an individual while they're also dealing with their mental health issues. So they not only are learning those skills while they're there, but they also get to participate in groups with their peers to talk about what it's like, what their recovery journey is, how they've been working on some of the different skills and getting that support from their peer group. And so individuals can come. The program is operates Monday through Friday from 8:30 till about 3. And so they can spend the whole day there interacting with other individuals and getting the support that they need. Another one of our services that you might not be as familiar with is our residential services. So we have housing. The CSB owns several properties where we have individual housing units that we help support individuals in independent living. We have one where there's 24/7 staff that is there on site with the individuals as they are learning the skills to manage their budget, learning how to clean an apartment and keep it maintained, learning how to get to and from using public transportation to get to their appointments and to our job. And so we have 10 units where we're able to do that with individuals. And then we also own some housing where there's not 24/7 staff, but we're providing financial support to them. We're subsidizing the housing because otherwise they wouldn't be able to afford to live independently. And so we help also support them in that way. And then we have, in the last 2 years, started a permanent supportive housing program. And what that is it's a program, as in the title, is permanent. So the idea is that the individual, that we're finding them a guarantee, if you would, stable housing for them. So it may not be the same housing unit all the time, but we're trying to, once they're in the program, we work very hard to make sure that they maintain some kind of stable housing, working very hard with landlords, property owners to find and locate housing for these individuals. The program doesn't require the individual to be well, so they can still be in the throes of their mental illness and still working towards that. But we provide the support for them through working with their landlords, having those relationships with them, which sometimes is difficult to navigate if you rented or had to read a lease or anything. Sometimes that can be difficult to navigate on your best day. And so we are there to help the folks do that as well. And then the last one down there, competency restoration services. So we have a unique relationship with the court system. And so in code, CSBs provide restoration services for individuals who are found incompetent to stand trial, meaning that at the time of their offense, in the hearing, they are unable to understand what it means to participate in their own defense. And so we will work with them to help them understand what it means to be a part of the legal system, to understand the legal terms, to understand what the process is. And then an independent evaluator determines whether or not competency was restored. Competency restoration is different than not guilty by reason of insanity. And so sometimes people get those confused. One is not competency restoration just means that they don't understand the legal proceedings. Not guilty by reason of insanity means at the time of the offense, when they committed the crime, they were in such a mental health state that they are found that they are not guilty because of their mental health state at the time of the offense, at the time of the crime. We follow both cases, so we also work with individuals that are found not guilty by reason of insanity. We work with them, we monitor them. Oftentimes in those events, and those individuals are sent to one of the state psychiatric hospitals for a period of time to receive treatment, and then the court determines the time that they can be released. And then we are in charge of monitoring them upon release. So we work very closely with several individuals who end up out in the community. We monitor their compliance with the courts, we monitor their compliance with treatment, and all of the requirements that the court has needed to be there for their release. We also provide children's services. So this is, we provide some of the same services for children and adults. On the other slide, you would have saw case management services, outpatient services, psychiatric or medication management services. Those are what I would call kind of your core services that a lot of people tend to be familiar with when it comes to the public mental health system. And we provide those services for kids. Some of the other ones that are on here is we have a school-based early intervention program where we partner with both Rockingham County Schools and the Harrisonburg City Public Schools to provide clinicians in the school to help support students. They're also a resource to the school personnel there in terms of what are some other community mental health services that they can help support their students with. And so we function as two things. One is a direct provider, but also as a resource to that school. We also participate in court anger management groups for teenagers who have unfortunately got involved in the legal system, and usually through probation or sometimes directly through the judge, they're ordered to attend our 8-week anger management group that just basically talks through kind of how to deal with emotions, how to manage that, what are some of the triggers, how do we negate those, how do you move past those and those types of things. We provide substance use services for primarily for adults. We're starting to inch our way into working with adolescents as well, as there's a growing need for adolescent substance use treatment in our community. We do some of the same things as we do for mental health with substance use. So we provide case management services, outpatient services, and the typical therapy services. Some other things that people might not know, we also screen for residential treatment facilities for substance use. So our community doesn't have any inpatient specifically for substance use. And so we have several community partners in other areas of the state that we will screen individuals and help them get linked and accepted there in those facilities, as well as for those who don't have a pay source to get that service, we can also provide funding. So we don't want funding to be the barrier to getting help. And so as needed, we are able to also provide some financial support for individuals to get the treatment that they need. And then the last one on there, over the last couple of years, we've been working to do harm reduction kits and revive training. So you may have heard in the news over the last couple of years about the opioid epidemic and crisis. And so we have been very intentional about working with our community partners with the Virginia Department of Health, as well as some other entities across the state to bring revive trainings. And revive training is it can be what we call rapid revive, which is a 15-minute training, or it can be an hour-long training that teaches you how to use naloxone, which is the life-saving medication that when someone has had an overdose, they are administered naloxone or Narcan at the time of their overdose, that it can save their life. And so we are able to provide the training for that as well as the Narcan. So we'll do the training, we'll teach you how to do it, and we'll give you the medication to have on hand in the event that you're around someone that would have be experiencing an overdose. We also do harm reduction kits. And so harm reduction kits are for individuals and their loved ones to have on hand that has fentanyl test strips, so they can test the medications or things that they're using to ensure that it doesn't have fentanyl in it. It also comes with a CPR mask, gloves, some sterile water, sharps disposable. So in the event that those things are near when an event happens, you can dispose of those things properly. And so we also give that out to our clients who are a part of our substance use programming. But we also give it out to family members, friends, loved ones, anyone who wants it. We are happy to provide it to individuals to help increase the likelihood of saving someone's life. In addition to the harm reduction kits, we also provide medication lock boxes, trigger locks, anything we can do to help prevent the loss of life, whether that's due to suicidal ideation or suicidal acts. We want to do what we can to prevent that, but also for substance use. So the medication lock boxes is to lock up your medications so that people don't get into them. We know that sometimes individuals will reach for medications at their lowest point and take more than they should. And so we also, having that barrier to getting that immediate medication can be life-saving as well. Those are all free things to anybody in our community. We also are at the farmers market, so I have a great team called the Behavioral Health Wellness Team who is out at the farmers market a couple times a year, usually at least once a month, that have all of this information, have all of it sitting out there for free for community members. So if you go to the farmers market, I would encourage you to stop by. And then we provide developmental services as well. Infant and toddler connection. For those of you who aren't aware of that, that is for birth to 3 years old. These are for little bitties that are born with some type of delay, or during the course of their early months, we discover that they're experiencing a delay in their normal or typical development. And so we have a team of speech therapists, physical therapists, occupational therapists, and case managers who provide support to the parents to help them provide interventions in their home, to help them help them teach their child things that they need to learn to increase their development over time. This can be, we get referrals from the hospital, so from the birthing center there, they can get started with us shortly after. So we try to get in there as soon as we possibly can, because we know that the chances of their development improving is the sooner that you get in there, the better chances are that development happening. So our team works very closely with the birthing center. We also work very closely with social services for individuals who are mothers who may have been using during pregnancy. That can often cause complications for the infant. And so we also get those referrals and can provide some intervention quite quickly. And then we provide regular case management services for individuals with developmental disabilities or intellectual disabilities across the lifespan. So we'll pick them up at the age of 3 once they finish infant and toddler, and then we can follow them through services all the way through adulthood. As I mentioned earlier, behavioral health wellness with our lock boxes. These are all the areas that they focus on. So they have quite the gamut of things that they are trying to promote and prevent in our community. Right now, their focus has been very much on the opioid crisis as well as suicide prevention. There's been a lot of efforts in both of those areas. And then recently, if you're not aware, with the gaming and gambling, that's mostly referring to online. Either there's a lot more apps that you can get that you can be betting on things. And so they're already seeing in states that have allowed gambling and gaming to occur that the rates of addiction to those things have greatly increased. And so that is one of our charges from the state, to start focusing on gathering information and looking at ways that we can help prevent gaming and gambling. And that is all about our services. I'm happy to answer any questions that you may have about our programs or about the CSV in general.
Hello.
Hi.
My name's Noah. I work at Mercy House. Very much in support of your permanent supportive housing program. You talked a little bit about the difficulties with landlords or working one-on-one with patient or client. Can you talk a little bit more about that? What does the PSH program look like for you here locally? What barriers have you had in using those vouchers? What does that look like for you?
Yeah. So we have 75 vouchers for PSH. And so what Noah's talking about with vouchers is we have a partnership with the Housing Authority. And so we have some vouchers of the Housing Authority that we can help utilize. And we also have vouchers from the Department of Behavioral Health. And vouchers basically it's a funding, so we can pay up to what the market value is, 70% of what the market value is of a single apartment or a double apartment, depending on if it's a two-person household. And so some of our challenges with that is certainly the availability of units, right? So as many of you may know, we don't have very many units available for individuals, especially on the lower income side, to be able to access stable and affordable housing. Our team, we have what they call housing specialists. We have 3 positions now that are just tasked with developing those relationships with landlords to help us find available units for folks. I would say that we've been tasked to go above and beyond in terms of incentivizing individuals to participate with us. We have funding to pay for damages to apartments, pay for different things within the apartment to help pay off debt, all kinds of things to help make sure that there aren't any barriers, financially at least, to an individual accessing that housing. But yeah, our greatest challenge is just finding available units, and we're at the point where we're even going, okay, what can we buy? Because what can we build? Because we're just not seeing the community respond fast enough for the need that is there.
Any given day, how many people are you working with in Rockingham County and Harrisonburg?
Yeah, so we provide, in a year, we serve over 6,100 individuals, unique individuals, between Harrisonburg and Rockingham. So I'm not sure what that breaks down per day, but that's what we do over a year's time.
So Paul's in first, and we'll get to see.
Well, thank you. Wow. I mean, that's quite a laundry list of services you all are providing. What's that trend like? Like, what would it have been 10 years ago, 20 years ago, and what do you see in the next 10 years in terms of that 61? And there were 1, 2, or 3 root causes of that problem.
So growth, we have seen growth increase, let's see. So when we started our building project in 2016, which is when we were doing the initial planning stages for it, we were serving more like 4,000 folks. And so we definitely have seen that exponentially gone up over the years. Last year we served 5,300 individuals. And so we're seeing that increase. I don't know, can't do the math in my head, but about 5 to 10% over the last 5 years or so, we've seen that increase happen. In terms of causes of that increase and where we head in the future. So I think obviously it makes sense. Harrisonburg and Rockingham keeps growing, so our services are going to have to keep growing. That just is what is to be expected. We can't expect for us to increase as a community and not need all of our social services and social supports also to grow in accordance with that. And so I would say we will continue to need to evolve our services to meet that need. We will also need as a CSB to evolve how we think about our services. Susan and I were talking about the need to be innovative and think differently than maybe how we provided services 20 years ago to individuals. The need is different, technology is different, opportunities are different than what they were. Some causes, I would say, certainly the pandemic. We know that for a fact, especially with our young folks, that social isolation for our youth was a huge factor in how they were managing life. We also know that that's true for older individuals as well. And so we are definitely seeing a huge increase in our children's services, the number of kids. We currently serve 650 individuals, kids in our children's therapy, where I would say even 3 years ago, we were more like 350, 400. So we are seeing that increase rapidly for the under 18 age group. And then in terms of other causes, other than the pandemic, I think that in general, we haven't done a great job of equipping people with how to manage life's challenges, the unexpected and the expected. And we have becoming less of a community that supports one another. So the pandemic certainly isolated us, but even before that, I think people were isolating, and we were so focused on an individual. What am I doing? What is good for me? What is good for how I live my life? And less focus was given on to how do we care as a community for one another? How do I rely on my neighbor? How do I get support from that? And I think as we move forward, we're going to have to actually look back on how do we reintegrate as a community and support one another. Because formal services are great, don't get me wrong, we have our place, but informal services are that important too. Finding that neighbor, that friend, that support system that can help manage and support you through some of those, I would say, typical life events that cause stress. And we see that people just don't have the ability to do that as much anymore.
You answered one of my questions, because I was going to say where your growth trends were. But my other is, what's your staffing look like? Do you have primarily permanent folks working for you, or is it primarily contract staff?
Sure. So we're primarily permanent support. So right now we are right around 230 employees. Most of my employees are full-time employees. We have our infant and toddler program. We contract for speech therapists and physical therapy and occupational therapists. We try to hire our own, but we also try to do a little bit of contracting there. But most of our other services are provided by permanent staff of our agency. Our staff range, we have from medical staff, nursing staff, to licensed social workers, licensed counselors, to bachelor's level social workers, and then of course all of our administrative support staff in terms of our clerical and our IT support and finance and all those very wonderful departments.
Thank you, Rebekah. Well done. Let's give her a round of applause.
Well, that's kind of a heavy, but also a great presentation. Again, we're reminded of the needs in our community. And Rebekah, thank you, because I think that's a line that I'll use for our membership meeting coming up. What does she say is that our community becomes isolated, not connected to others in the community, not being aware of our community needs. And that's one of the reasons why we're here as Rotarians, to learn about situations in our community. So thank you for informing us, and thank you all for being here. And we will hopefully see you next Monday, and we are adjourned.